Can you hear me now? Yeah. So what is metabolic syndrome? It is a type of multifactorial metabolic disease with the presence of at least 3 of these factors like obesity, diabetes mellitus, low high density lipoprotein, hypertriglyceridemia and hypertension. Now why we are discussing metabolic syndrome in relation to breast cancer at all? Metabolic syndrome and its related components, they exert a significant impact on the initiation, progression, treatment response and prognosis of breast cancer. Metabolic abnormalities not only increase the disease risk and aggravate tumor progression, but also lead to unfavorable treatment responses and more treatment side effects. Biochemical reactions that are caused by the imbalance of these metabolic components, they affect both the host general state and the organ specific tumor microenvironment, resulting in increased rates of recurrence and mortality of breast cancer. Besides the conditions I have told, hyperuricemia and increased levels of fibrinogen are also associated with so-called metabolic syndrome, also known as insulin resistance syndrome, syndrome X or Revens syndrome. And recently, metabolic syndrome has been associated to play a significant part in breast carcinogenesis. Now, how does it lead to breast cancer? It is associated with greater abdominal visceral obesity, and this leads to anomalous insulin signaling through insulin receptor substrate 1 pathway, which leads to insulin resistance, hyperinsulinemia and increased concentrations of androgynous estrogen as well as androgens. Now, the breast carcinogenesis is driven by cell proliferation in response to sex hormones, polypeptide growth hormones and insulin-like growth factor and insulin itself. Now, this is the interplay of various factors of metabolic syndrome in causing breast carcinogen. You see all the different cytokines get altered and they interact together to lead to breast carcinogenesis. Now, it has been established that risk of postmenopausal breast cancer is associated with metabolic syndrome. It also leads to greater tumor burden and higher histopathological states. Now, it was related to hormone receptor negative breast cancer in premenopausal women and hormone receptor positive breast cancer in postmenopausal women. And they found out that waist circumference and waist hip ratio were more significant than actual BMI which was calculated. Abdominal obesity was correlated with more aggressive molecular types regardless of the menopausal state of the woman. Now, these are the various things which lead to breast carcinogenesis. There may be comorbidities. The health behavior is different in metabolic syndrome with breast cancer. Then there are systemic therapy issues are there. There are more complications related to obesity, tumor biology, microenvironment changes, and there is often delayed presentation because in obesity they feel their lumps later on when they have advanced in stage. Now, I have already told that abdominal adipose is an important source of androgens as well as estrogens. Obese women have high level of estrogens which facilitate the breast carcinogenesis. Now, how besides obesity, diabetes mellitus, which may be a coexisting factor, how does it relate? It causes hyperinsulinemia and insulin resistance, which it themselves are risk factor for development of breast cancer. Now, the correlation between diabetes and breast cancer subtypes still needs to be explored. It has been hypothesized that the breast cancer cells, they are glucose hungry. So, in diabetic patients, there is increased glucose availability which facilitates growth of these breast cancer rapidly dividing cells. And glucose itself is known to cause production of free radicals and induction of oxidative injury to the DNA and the enzymes which are involved in the repair of these DNA. Now, insulin receptor and insulin-like growth factor 1 receptor, they are widely expressed in breast cancer cells and they help in promotion of cell proliferation. We welcome Sharda Jan ma'am. Welcome ma'am. And the action is mainly through insulin receptor substrate, PI3K and RAS and MAPK pathways. Studies have suggested that hyperinsulinemia and its sequelae can increase the promotion of breast carcinogenesis, and it is also related to the increased bioactivity of IGF-1. Now, there was some benefit which was narrated to metformin because it is said it can block breast cancer cycle progression and induce selective apoptosis. It has known to have some tumor suppressive effect on breast cancer. Now, on the other way, insulin, it has a gonadotrophic effect. You see in the diagram, it causes more secretion of LH-FSH, and ovarian stroma itself is stimulated by insulin to produce more androgens which form the substrate for development of estrogen in peripheral adipose tissue. So, estrogens also increase. Moreover, insulin is known to cause decrease in liver production of sex hormone binding globulin. Now, when SHBG decreases, more estrogen is bioavailable, causing synthesis of tumor cells. Another is besides more availability of IGF, the activity is also more. Why this happens? Along with this, insulin causes decrease in the binding receptors, the binding proteins of insulin like growth factor 1. So, when the binding proteins decrease, the bioavailability of IGF-1 also increases. So, both insulin and IGF-1, they join with estrogen to cause breast carcinogenesis. Now, if we see that metabolic syndrome is also associated with more inflammatory cytokines, and there is more leptin. Leptin is said to be stimulant to the cell proliferation in the breast, and metabolic syndrome causes decrease in secretion of adiponectin, which is the down regulator of tumor cell, and it upregulates apoptosis. So, what happens when there is decreased adiponectin? There is more progression of tumor cell synthesis. This I have already discussed. So, increased physical activity and healthy dietary practices were said to be helpful in prevention of development of breast carcinogenesis. Hypertension was also associated with development of breast cancer as a part of metabolic syndrome as well as a separate entity, because it is said that it increases subchronic subclinical inflammation, and these inflammatory cytokines, they help in the tumor formation. If we see this graph, the most commonly happening comorbidity in breast cancer patient was hypertension, but some say that it may be due to the increased anxiety that these patients have when they attend the breast cancer clinics. Dyslipidemia is another independent factor. HDL cholesterol is often found to be low and LDL is high in these patients. So, there was some improvement by lipid lowering strategies. They say that statins, they do help in prevention of transformation of cells into malignant cells. There was a particular thing which I will like to quote, that in the mammary gland there is interaction between obese adipocytes and breast cancer cells, which leads to the transformation of mammary adipocytes into cancer associated adipocytes, which secrete more leptin, which I have told you leptin increases the carcinogenic cells and reduces the adiponectin, so apoptosis goes down. So this becomes a vicious cycle. More and more leptin is available and it causes further progression of the breast tumor. So leptin I have already discussed. So leptin signaling is very important, and it has been shown that it can be a predictive biomarker and a novel therapeutic agent also in the future to come. Studies have concluded that leptin and adiponectin receptor seem to be the most promising molecular targets for the treatment of metabolic syndrome related cancers. So prognosis is also affected by metabolic syndrome. I will not, because of lack of time, they say that, metformin and statins, low calorie fat diet and appropriate exercise to reduce the comorbidities is important in breast cancer patients also. The survival increases with use of metformin and statins. It was said that if the patient is using statins for more than 5 years, it was very, very helpful in the better prognosis of patient, but use less than 5 years was not found to be that significant. So exercise and all that, these things are important. So to conclude, metabolic syndrome and its components have been widely described to correlate with the initiation as well as progression of breast cancer. This is due to obesity and its related adipokines, insulin-like growth factor, abnormal serum lipids and lipoproteins. The molecular changes that are happening in metabolic syndrome, they have a profound influence on the tumor and its microenvironment. So metabolic syndrome is significantly associated with increased risk, worse treatment response. Because of the comorbidities, they are not tolerating chemotherapy and radiotherapy that well. There is more invasive progression and poor prognosis of the breast cancer. So multimodality actions involving nutrition, exercise, stress reduction, all these things become important to decrease the insulin resistance and improve cancer outcomes. And we must intervene earlier for first degree relatives of breast cancer patients. Thank you so much. Thank you for your listening.